So, if you're on social media, which obviously you are, you're going to see a lot of different types of therapy talked about. And how do you know what's best for you? Well, let's dig into that today. I'm Kathy Shorman. I am a licensed clinical professional counselor, a trauma expert, and a certified neuro-linguistics programming practitioner. I'm also the owner of Monarch Therapies. Would love if you would visit our website, give us a call, send us a message. Be happy to help you on this journey. So let's dig into it. A lot of people have heard about talk therapy, and there's lots of different types of talk therapy. There's CBT or cognitive behavioral therapy. There's art therapy. There's play therapy. There's EMDR. A lot of people have heard of eye movement, desensitization. Um, So, what do they all mean and what makes sense for you? Well, I'm going to give you a quick and dirty breakdown. Um, your traditional talk therapy, a lot of people are going to be rooted in that. That's cognitive behavioral therapy or different variations of that, where they're looking at how you're thinking, the cognitive, and how your thinking is affecting your behaviors, cognitive, behavioral, and how that's coming out in your words. So uh, that can be really impactful. There's a lot of evidence based research on the effectiveness of that. And there's different variations based on, like, if you're presenting for trauma or if you're presenting for, say, personality issues. There's a lot of different variations of that. Then we also have more trauma focused therapy that might use a somatic approach. We call that a bottom up approach. You ever heard somebody say, "Where are you feeling that in your body?" And that's a somatic way of looking at how you're feeling. It's important also, especially I find with working with trauma. Other trauma-based therapies might include things that include rapid eye movement or bilateral movement, like EMDR, accelerated resolution therapy, brain spotting. Um, those are very key and researched ways of dealing with trauma. Then there's family systems or narrative therapy, and a lot of that deals with different looking at the systems and how things may have developed in your way of thinking. It's going to, you might have heard of parts work. Sometimes people might even say shadow work in here. But looking at the different parts within the system of your internal thinking as well as within your relationships. And then you might hear people say, I have a more integrated or holistic way of thinking. Well, okay. I'm probably a little more integrated and holistic. I like to take the brain science, I like to mix it with somatic. I like to throw in a little bit of the bilateral movement. And, so holistic might be a combination of a bunch of things. And then lastly, going back to the daddy Freud, we have a psychodynamic approach. And are you going to talk about your mom? Maybe. Yeah, well, you're definitely going to talk about your mom. But it's really going to be looking at unpacking those patterns that occurred in your childhood and how they're playing out into your life now. So that's a quick and dirty, and I know that I haven't covered all of the different types out there, but that gives you a flavor of the basic approaches that a lot of therapists, and something important for you to think about when choosing the right therapist would be what feels right for you. Does it feel right to come from a brain cognitive viewpoint and talk about it? Are you more of a are you feeling a lot of the emotion in your body, and would it be good to have someone who focuses on getting that energy out? Or do you really feel like you need to examine the past in order to understand the now and plan for the future? So I hope that this helped give you just a little bit of insight. And if you'd like more conversation, please feel free to reach out to us at Monarch Therapies. Visit our website, send us a message. We'd love to hear from you. And as always, see you. I love it. Talk to you later.